Welcome back to Get Moving TV. As a practicing pediatrician, we have clinics throughout the county, and we brought several years ago Dr. Kathy Kim to talk about dental varnish. What we see, even more so in the Hispanic community, is dental decay. We have to have early access to caries. You have to have early access to carie prevention using the fluoride varnish. So we have an educator with me today.
Hi, my name is Letty Alvarez, and I'm a Community Services Coordinator for Ventura County Public Health. And since Dr. Kim has been here last, we've had probably applied about 14,000 varnishes throughout Ventura County to prevent tooth decay in the medical setting. And it works really well. We have seen a few hundred reduction in identification in caries. But like you mentioned, we continue to find tooth decay in the Hispanic community. And so we're constantly referring children to the dentist early. The physicians referring early has really made a difference. When I'm in the medical office discussing this with patients or the parents, I'll ask them, have you been to the dentist? And they'll say yes. And it's due to a doctor referring early, parents asking a doctor, should I take my child to the dentist? And can you please put varnish on my child? So we are seeing a slight reduction, but we're seeing an increase in dental visits. The Mixteco community, we are seeing the increases because they have the resource of MyCop. It's helped tremendously that they're getting the education from them, and they're getting the referrals from multiple agencies. So we just need the agencies to continue to do referrals. Every referral counts.
Yeah, as a pediatrician, if I need kids to succeed in school, and if they can't eat, if their teeth hurt, they're really not succeeding. And my poor schools go, Dr. Landon, we're not the super parent. We're here for reading, writing, arithmetic, and that's it. We see little peaks. We have DEntalPrvention coverage, and yet we don't see those kids being referred at age 1 and 2 and 3. This is a sudden little peak just before they hit kindergarten, and then somewhere kind of late childhood, early adolescence, they seem to peak again.
Well, it's because they're getting those referrals, and then they'll say, oh, well, everything's fine. But within a 6-month period, a child can develop cavities. So that's why it's important for a child after 3 to see a dentist every 6 months, so that all of a sudden it doesn't peak. And so we can continue to prevent tooth decay, because if a child goes to school with tooth decay, they're not sleeping because they're in pain, they're not eating well. So if they're not sleeping and they're not eating well, they're not going to learn. And so it's all, prevention is the key.
So how does a patient access DentaCal? How can we help them with that?
Well, through public health, through human services, they can go to an office and apply for Medi-Cal, which is a DentaCal program also. They can contact public health, and online, we have online access. And so if they apply for a Medi-Cal, they automatically get put onto DentaCal. And if they don't qualify, we have other programs that they can qualify for. So there's no reason for a child to not have coverage.
And I think that's really the key. Now, it's wonderful to have dental partners who will take, everybody worries about Medi-Cal rates and DentaCal rates, and so they're really contributing back to the community when they help us out. Are there dentists up in East County and Thousand Oaks and Moore Park and Simi and Oxnard and Ventura?
Yes, I provide medical offices with the list of DentaCal providers and healthy family providers that they can give to their patients each time they do a referral. So that works out wonderful, and if nonprofits contact me, then I provide them with the list also. So I have an ongoing list broken down from the day they're open to the languages they speak.
Well, what a great resource. You have a great smile.
Thank you.
Ventura, it's time for you to get moving to that dentist, become more culturally aware by getting involved with the Mixteco project. So Ventura, time to get moving.